Hello everyone, welcome to our channel. By the names I'm called Wefafa Andrew, and today we are going to talk about peptic ulcer disease. But before we talk about it, if it's your first time, I request you to consider subscribing to our channel by clicking that red subscription button, and also remember to share and like this video. Peptic ulcer disease is a condition whereby there is a break in the integrity of the gastroduodenal mucosa. So this condition is characterized by sores or ulcers in the lining or in the mucosa of the stomach and the duodenum. Now, the integrity of the gastroduodenal mucosa is brought about by the balance between the offensive and the protective mechanisms. So the protective mechanism of the stomach includes the mucus, the bicarbonate ions, and the prostaglandins, while the offensive mechanisms include those ones which increase acid production or which increase the amount of acid, and those ones which break down the mucosa. Those ones which break down the mucosa, we have drugs like non-steroidal anti-inflammatory drugs, steroids, and also an infection by Helicobacter pylori. Those ones which increase acid production, it can be a condition like Zollinger-Ellison syndrome, taking of too much alcohol, smoking, cigarette, or it can also be due to taking too much caffeinated drinks and also spicy foods. So peptic ulcer disease is divided into two major types. We have gastric ulcers and duodenal ulcers. How does someone with peptic ulcer disease actually present? A patient will present with dyspepsia, which is described as indigestion. It is characterized by feeling of the gas, feeling of fullness after eating even just small quantities of food. Also, a patient will present with epigastric pain, which is pain in the upper part of the abdomen, and this pain differs depending on the type of the ulcer someone is having. For example, with duodenal ulcer, which is the most common type, someone will present with pain which is relieved on eating food, and also that pain is worse at night, or it comes few hours after eating food. People with the gastric ulcers, they will present with epigastric pain, which is worse during the day and after taking food. Another feature which differentiates these two types is a gastric ulcer is characterized by loss in weight, and then a duodenal ulcer is characterized by gain in weight. I think it is because people with gastric ulcer always feel pain when they eat food, while with duodenal ulcers, the pain is relieved when you eat food. Also, someone may feel regurgitation, nausea, and occasionally vomiting. But sometimes patients report on the facilities when it is late. So when you delay, you may present with a bleeding ulcer, which is characterized by signs of anemia, and then also you may have other signs like blood in stool, or sometimes you may vomit blood. Patients may also report when they have a perforated ulcer, which is characterized by signs of shock like weak pulse, cold extremities, and low blood pressure. So what are some of the differential diagnoses of peptic ulcer disease, or things which present in the same way? We have other conditions like pancreatitis, conditions like hepatitis, and then some conditions which affect the lung, mostly those ones which present with hemoptysis or bloody sputum. Then we have other conditions of the heart, like myocardial infarction, and then also other conditions which affect the aorta. How can a patient with peptic ulcer disease be investigated? They can analyze the stool to look for the antigen of Helicobacter pylori. They can also do upper GIT endoscopy, a barium meal, and sometimes also a biopsy can be taken. So how can someone with peptic ulcer disease be managed, or how can it be treated? First, we have to work on the diet. Diet modification is very important. We know very well that food does not cause or heal ulcers, but we have some foods which worsen the signs of ulcers, and then we have those ones which relieve the signs. So foods which someone should avoid with peptic ulcer disease are foods like alcohol, things like coffee, citrus fruits like oranges, and then also deep fried foods or spicy foods. Foods which I can advise someone to take, we have foods like green vegetables, we have foods like fish, eggs, yogurt, or other fermented milk products, and then we also have foods like carrots and others. Another thing, we need to avoid the cause, because the cause of ulcers may not be only the infection. We have other things like those people who take NSAIDs for long. So those people are advised to stop, and their ulcers will improve if they stop taking those medication. But people who are meant to take steroids or NSAIDs for long, they can also cover it with a proton pump inhibitor. Also, lifestyle modification, like people who are stressed, they can avoid stressful events, and then also people who skip meals should avoid that. So that can also help to improve on the signs. But people who test H. pylori positive, they are encouraged to take what they call the triple therapy, or if it fails, you can go as far as taking the quadruple therapy. A triple therapy consists of a proton pump inhibitor like lansoprazole, metronidazole or amoxicillin, and clarithromycin. A quadruple therapy consists of 4 drugs, can have a tetracycline, metronidazole, and then a proton pump inhibitor like lansoprazole, and then a subcitrate. So what are the complications of peptic ulcer disease? With complications like perforation, which is usually common with the duodenal ulcers, and then we have other complications like hemorrhage or bleeding, and then we can have also some other complications like pyloric stenosis. This happens when the ulcer heals with scar formation. If you found this video important, I request you to consider subscribing to our channel, like and share the video. And also, I would like you to write something in the comment section such that I can know what maybe you wanted me to talk about, or you may write there your addition or subtraction. Thank you very much. God bless you.